Welcome to Stories of Care, a podcast from the American Medical Association and the CDC's Project First Line. On this episode, I spoke with Dr. Nicole Jedlinski, a family medicine and sports medicine physician practicing in Kansas City, Kansas. As a petite and athletic woman, Dr. Jedlinski has struggled to find properly fitting PPE, a problem greatly exacerbated by the COVID-19 pandemic. We're also joined by Dr. David Kuhar, an infectious disease physician at the CDC's Division of Healthcare Quality and Promotion. Together, we discuss Dr. Jedlinski's story and the importance of access to properly fitting PPE, both as a matter of safety for practitioners and patients, and as a critical aspect of creating diverse, inclusive healthcare environments where everyone is supported and treated equitably. Hi, Dr. Jedlinski and Dr. Kuhar. Thank you so much for being here and joining us today to discuss such an important topic. To start, Dr. Jedlinski, I'd love you to tell us a little bit about your experience in this area and what your background is.
So specifically, I am a sports medicine and family medicine physician. And so we found that during the pandemic, especially, we were running into issues with obtaining personal protective equipment, particularly otherwise known as PPEs, particularly PPE that was of a good fit, especially for individuals who maybe don't fit the quote unquote standard size of physicians.
Mm-hmm. Is this something new that popped up during the pandemic, or did you have issues even prior to the pandemic?
Yeah, I think the issues existed well prior to the pandemic. I just think it was something that was highlighted and exacerbated during the pandemic, especially during the early days when it was so important for us to have really good fit for, say, an N95 mask, or the respirators or the gowns that we were wearing early on. Initially in the pandemic, we just didn't have all the information to know how COVID was transmitted, what were risks, what weren't risks. And so we were trying to be as safe as possible. And the issues that we were running into was having equipment that we felt appropriately protected us in the clinical environment while still being able to provide excellent care. Medicine has a high demand on physicians. It's a emotional demand, it's a mental demand, it's a psychological demand. And when you don't have gear that fits appropriately, it really takes that extra toll. And especially in clinical spaces where we're being asked to work extra hours, it just took more of a demand than prior to the pandemic.
No, that makes complete sense. And when you don't have the right gear, how do you balance your need to take care of patients and that oath that you take while still trying to keep your well-being in mind? How did you all handle that on the front lines? What did you experience?
So in my situation, right, I think that this was probably more unique to females in the medical space. Just overall, there's the truth that females on average are smaller than our male colleagues. And as a result, I had to get fitted several times for a different N95 mask. So I had to go in, get fitted, had to try several different kinds before I found one that worked for me. And then about 2 weeks later, with all of the supply chain issues, that one they couldn't get in stock. So then I had to go back. I also had another issue with finding eye protection that worked well and didn't fog up, that also fit my face. And that was another issue. We have a lot of focus in the clinical space of making sure that we're as inclusive as possible. And I think part of that inclusivity needs to focus on making sure that all of the individuals that we are saying we want to welcome into that space need to be made to feel welcome. And one of the ways that we need to do that is by making sure that all of the supplies that we need to do our job well are available to us.
Mm-hmm. No, that's a great point. And I'd love to bring in Dr. Kuhar at this point. If you could start by giving us a little bit about your background and what your experiences then were with exactly what Dr. Jedlinski is talking about.
Yeah, absolutely. So I'm David Kuhar. I'm an infectious diseases doctor by training. My usual day job, I work for CDC in the Division of Healthcare Quality Promotion, and we put out the infection control recommendations for healthcare settings, inpatient and outpatient settings. So it covers them all. The pandemic. Wow, what can I say? And especially in the early days. I should also say, I am still clinically active and I do part-time practice at a local hospital. So I think I see both the public health end as well as some of the clinical end as well. And I almost don't know where to start. Personal protective equipment is key for healthcare workers. And if you think about protection in healthcare, we have a lot of controls in place that keep us all safe. We have things like engineering controls that, air systems that, clear the air. We have administrative controls, like things like work processes that help keep us safe, like putting a patient in a separate room, et cetera. But when it comes down to it, believe it or not, even though we think of it as the least effective method, personal protective equipment, because it's dependent upon being used consistently and correctly, it's super important to morale, feeling like you're safe and being able to do your job. And it is the last line of defense when we have to be, face to face with someone. Companies try to make these so that they're going to fit the widest range of body designs possible. Right? It's better for them if they do, because they're able to accommodate more people, et cetera. But it's never perfect. and there are people who are outliers, and I think have absolutely a tougher challenge in finding the right manufacturer who's making the right size that it fits them, and it makes it harder, and it's super unfortunate. And then I think the pandemic itself made this so much more challenging, as we had essentially a crisis in personal protective equipment, where we started to run out of all of the critical supplies that we needed. I think there were probably a lot of reasons for this, including lacking, I think, an ability to locally produce a lot of what was needed. We had been importing a lot of this for a long time, which just caused a crunch like I think none of us have ever seen in our careers. Where am I going with this? I almost don't know what more I can say. This is a super important topic. It's critical that we have appropriate fit and appropriate supplies available. And I could even go on, I don't want to go too far. I mean, the fit is also key to protection. There's an OSHA standard, the Occupational Safety and Health Administration, Personal Protective Equipment Standard. All employers have to provide appropriate equipment to their employees. This includes healthcare. And going, a step beyond, we are supposed to be taught what we need, when to use it, how to use it. And that includes being able to remove it without contaminating ourselves. And when your equipment might not fit quite correctly, it can make removing that equipment and keeping yourself safe also more difficult. Mm-hmm. So I mean, what Dr. Jedlinski, I think, is talking about is probably unfortunately not that uncommon a perspective in the pandemic. And I can say I certainly saw dwindling supplies in clinical practice when out there. It was, I'd say, the first time in my career I felt like I've ever seen anything like this, and hopefully the last.
Mm-hmm. Yeah. And with the dwindling supplies, you would often find that certain sizes would run out more quickly. And how did that impact it? I mean, when we're looking at all of this infection control approach, we also have to keep equity in mind as you're talking about different fits and everything of that nature. So the dwindling supplies themselves, how did you see it impact the equity of our healthcare systems and being able to provide for our employees? Dr. Jedlinski, I'll send that one to you first.
Yeah, well, I think, much like what Dr. Kuhar said about protection, right? So if you don't have those supplies available, but you still have a job to do, still have a mission, still have patients to take care of, then maybe you're sacrificing your own protection, your own safety for the needs of those patients. And for sure, on one day, if something wasn't available, then you sort of had to scramble to make something else work. For some individuals who couldn't find a certain mask in the size that they needed, then they had to resort to, say, there's the PAPRs, which is like a portable device. That's almost like wearing a whole hood on your face. And many of our patients have communication issues, whether it's speaking a language other than English and having to use interpreters, or perhaps our patients who are hard of hearing, and then just added an extra layer of difficulty to providing that necessary patient care. I think it also probably led to many physicians maybe cutting corners and putting their own safety at risk, because they were just going to take care of the patient and take their chances if they didn't have the supplies that they needed. And that's an unfortunate situation. I think it led to a lot of burnout among our physicians, who really felt like they were at their limits when it came to the patient load and all of those things, just having to do with the pandemic in general. But then when their own personal safety was at risk, then it just added to that.
And I can actually really relate to what you're talking about, Dr. Jedlinski. I ended up catching COVID myself in March of 2020 because I was taking care of a patient and didn't have a mask, but my patient needed oxygenation immediately. And luckily for me, I recovered quite easily. I did have a bout of long COVID, but I definitely see the impact personally, and having it be in such a widespread system is concerning. And our conversation has been so focused on a lot of the patient care side of things. It makes me also wonder then about the other employees in the healthcare system, the people who are helping with EVS, the other people who are going in and out of these rooms that are at so much risk. What did you see, Dr. Kuhar, from your perspective at looking at many of these guidelines and the supply chain? How are those employees also taken into consideration with the fit tests and the need to have these different varieties of sizes?
And I can tell you things that we heard from a lot of facilities that were struggling. So, first, it was interesting to hear Dr. Jedlinski talk about how she'd get fit tested to one N95 respirator, and then the supply runs out and you get another one and you feel like you're starting over. We had heard about facilities that were getting supplies shipped in, and they get a different respirator every week. And if they didn't have someone on site who could fit test them, they'd have to schedule an appointment to have someone come back, and would probably spend 4 days of the week with everybody wearing respirators that they weren't fit tested to get them finally fit tested, and then to get another model starting the next week. And sort of this ongoing supply changes, making this really difficult, if not impossible, to do well. A lot of facilities felt like, because of many of the strains, I think that they were in the position that they felt like they had to, I almost want to say, designate the supplies for certain areas and certain kinds of patient care. So they were not going to offer, make respirators and things readily available off of, say, the COVID-19 care ward and other areas. And I think this absolutely caused feelings of inequity among sometimes different physicians working in other parts of the hospital, feeling like, hey, I'm still doing something where a respirator could be indicated. Am I really not going to have one available to me? Is this really where, are these other places more important? And so I think that the effects were even far beyond just COVID care in general. It was widespread in a healthcare facility. And that was awful and something else, truly. And I think, to your other question about, what about other types of healthcare workers? I felt like there was impact across the healthcare worker spectrum. Everybody felt this to some degree if you were involved in providing patient care. I think our nurses were the ones that probably felt it a lot the most. If you think about the tasks or the jobs that a nurse does every day, this involves a lot of intense, close contact with the people that they're caring for. And in some ways, you could argue a nurse probably has the most contact in a day with a contagious patient, meaning they're probably among different healthcare worker groups, probably among the most consistently at higher risk for exposure should they not have the equipment. And I think we saw a lot of attrition among nurses in general, and nursing shortages became an incredible problem throughout.
Mm-hmm. And from your perspective, Dr. Jedlinski, in the direct care setting, did you notice, even prior to the pandemic really setting in, were there issues with fit testing being available at the frequency needed? Some of what Dr. Kuhar was talking about happening during the pandemic, was that an issue even before?
Not particularly, mostly because outside of a infectious disease setting, we really didn't need to have that such a high level of infectious disease control. It really wasn't anything, maybe if you had a patient who was admitted with suspicion of, say, tuberculosis, then all of a sudden it was this higher level of care and concern. But before the pandemic, it didn't really highlight anything. Now, I think there were still some issues with fit. Like, for example, I take care of obstetrical patients. I deliver babies. And I noticed before the pandemic that whoever was supplying the gowns that we use, all of a sudden it seemed like these gowns were several sizes much bigger. And so I was almost swimming in them when I was trying to put them on. I'm only 5'3". I'm not the tallest person in the world. And and that was even before the pandemic, to Dr. Kuhar's point, right? It's somewhat to the advantage of the suppliers to make it a one size fits all, but then that really can impact the healthcare workers' ability to perform the tasks that they need to perform. Because I'm swimming in it's not even fabric; it's like a coated plastic paper, but it just adds an extra level.
Mm-hmm. And how about from your perspective, Dr. Kuhar, were you seeing patterns of other healthcare workers or even other healthcare settings that were having issues with fit testing prior to the pandemic?
Prior to the pandemic, not so much. I think it's that the settings that generally use respirators and use them with relative frequency fit test their staff. And I'm sure it's not perfect everywhere out there, but that's what they're supposed to do. And that's what they're, held to by requirements, et cetera. But during the pandemic, the other really challenging thing that happened is suddenly nursing homes, outpatient settings, and other areas that never used really respirators before suddenly needed to fit test their staff and gain a supply, or basically develop a new supply chain where supplies were dwindling and all the usual supply chains were running out. And so it was that it placed, I think, extra stress on them, and it was it placed them in a position where they had to kind of develop a respiratory protection program for their workers in the middle of all supplies running out. Absolutely a challenge. And I would say we definitely heard a lot about challenges in that outpatient area, as well as nursing homes, who I think in particular were getting what I described, a different type of N95 sent to them every week, and making it, and they're typically a place that does not have someone with an occupational health background and who can fit test on site, making scheduling and getting this done, consistently for their employees almost impossible. I think almost never imagined that was what was going to happen, but it absolutely did, and it was pretty widespread.
Yeah, and to add to that, before the pandemic, you had such a small percentage of our patient population who were possibly, highly infectious, that you needed to wear higher level of PPE to take care of them. Where then during the pandemic, all of a sudden, it was so many more people needed to be wearing this higher level of protection. And then it was just a numbers game. So you needed more equipment for more people And that equipment is, for the most part, one-time use, which then all of a sudden, now you need more of it to go see the next patient, the next patient, the next patient. Whereas if you have just one patient who needs higher level protection, then you can much better limit the number of interactions with staff. And then it's not that higher volume of supplies.
And how did you account for this in the beginning? I mean, we've had kind of a 2 years of a variable kind of curve as far as what's been available to us with, the sudden surge of need at the beginning, and then finally we're being able to catch up from a supply chain perspective. So before we were really able to get there, how did you accommodate this need for a sudden surge in a way that still was trying to keep equity in mind and an ability to provide for all staff?
I work for a very large academic medical center. So thankfully it wasn't up to me to do all of the ordering. So it wasn't as big of an issue, but we definitely saw, there was more than one surge, at least in our location where I work. And actually, we ran into issues at several points in the pandemic. It wasn't just at the beginning. It was also then, we had another surge at the end of 2021 and saw some of those issues coming back because it was a current issue. And, then we had all of those higher supply chain issues that had then more to do with ships that were coming over and getting stuck and not being able to download their supplies at the different ports. And, so there were lots of issues at different points, and it seemed to be maybe different issues at different times where those factors came into play.
Mm-hmm. And so what you're telling me, which also raises concern because it was so recent, was that even in the latest surge, we still didn't have a lot of those supply issues yet stabilized.
Yeah, it seemed to be different issues at different times, depending on where in the pandemic we were and what issues we were dealing with. So later on in the pandemic, it was different issues than at the beginning. At the beginning, it was more making sure everybody was fit tested, making sure people had the equipment that they needed, and then later on down the road, it became some of the different factors that came into play.
So was the equipment and the fit testing not as big of an issue than with this most recent surge, or was it still surrounding those same things?
It was still an issue. It was just kind of different factors that went into why it was an issue at different times in the pandemic. Towards this most recent surge, we had a better grip, I think, on maybe which patients needed higher level of protection and which ones, towards the end of the pandemic, there was much less of a concern about contact precautions, right? Because we really honed in on the fact that this was, aerosolized. So we didn't need to do as much of the contact precautions. So then the focus could then be more on the respirators and the N95s and those types of equipment and protection. But we still ran into issues with that.
And what are you doing to kind of mitigate potential issues that might arise if there is another surge in the future, as we're anticipating, something to happen in the fall/winter?
That's a really good question, and I'm not sure that I know the answer to that.
Dr. Kuhar, I'm sure that your body's probably trying to figure out this very question, has been working on this. This might be something that you may be able to help us on.
Well, this is a question that's much bigger than CDC. This is much bigger. This is about, for better or worse, we have a free market here for those who develop and make these things. And it's really about a higher level of coordination and sort of making sure that manufacturers are going to have supplies available for us. And, I think that the early surges where we ran out of equipment has also left everyone feeling unsure about what happens with the next surge. Are the supplies going to hold? And when the surge starts, I think a lot of facilities and practices start conserving personal protective equipment. They start using it not in sort of the standard ways that we do, which is, a single shot with each patient, but want to start extending use and doing other things because you feel, is the next shipment really coming? Can I rely on it? And don't want to run out. And so that feeling of uncertainty, I think, has also led to, some of just conservation, maybe even when it might not be necessary. I know that there have been a lot of efforts to ensure that there will be that local production can be ramped up. Should there be another surge, another huge increase in demand, and that there are pieces in place to do this that were not present earlier. And I think this has been seen, by the White House, and I think honestly by everybody in healthcare as like a key priority. If we can't keep ourselves safe and feeling safe when caring for people, you feel like you almost can't ensure the safety of your patients. The system starts to fall apart, and that needs to just never happen again.
And you touched on a couple of things that really piqued my interest there, and I would love both of your perspectives on this. First, you mentioned conservation practices when things start to pick up. And, we've heard so many different things, extending the amount of utilization over a period of time and kind of foregoing some of the typical things that we do. Were some of these practices that you saw, did they ever raise concern for safety in some of the things that were being done?
Yeah. So, at the beginning of the pandemic, we were encouraged to reuse an N95 and send it out for cleaning. We kept them in these paper bags that had our name on it. And yeah, absolutely. It was like, okay, is this providing the same level of protection as, given that it was something that was supposed to be a single use item, and there were reassurances that it was safe, that it was fine. But I think always in the back of our minds, there was that question.
And then that tags right back to what you were talking about burnout amongst healthcare workers and feeling like they're not necessarily having their well-being kept in mind.
Yeah, there seems to be this hope, right, that we won't be in this situation again, that this is a 1 in 100 years pandemic, and maybe we can take some of the lessons that we learned, but hopefully never have to deal with them again. But I think that is probably not a great strategy for moving forward, and that maybe these whole ideas of the production and being able to ramp up production, perhaps even having stockpiles of supplies available, and again, if our goal in healthcare is to have more diversity and equity, then we also need to look at making sure that the supplies that we have available serve that purpose as well, and that everyone who wants a place in healthcare feels that they are supported and safe and welcome.
And that's a really important point that you brought up before and bringing up again, the whole aspect of equity with these fits and ensuring that we're really taking into account people's identities and enabling them to feel safe while also monitoring the diversity and ensuring that their identities are being upheld. And I know as physicians, we often get modules and everything that teach us about the importance of fit that we have to take every single year. And so it's drilled into us. And we also have that experience from learning about it from a disease perspective. What about employees that are still involved in patient care, but don't necessarily have the healthcare background or expertise in these materials? Did you find that it was difficult to ensure that everybody was getting access to information to ensure that they were donning and doffing correctly, that they were understanding the importance of utilizing the right mask and the right fit at each time? Was that an issue that was challenging during the pandemic for you all?
I think at our location, it was more making sure that kudos to where I work, that was actually well-distributed information and making sure that everybody was on the same page. We had lots of signage around and making sure that everybody knew what they were supposed to be doing, what locations needed what level of PPE. And so that was definitely something that we did well here.
That's really great to hear. And Dr. Kuhar, I noticed you started to look like you were interested in commenting on that as well.
Yeah, I mean, I think it sort of depends on the healthcare setting.
Mhm.
I think how hard sort of expanding personal protective equipment use was on staff, et cetera. But if you think about it too, we went to universal source control in healthcare, we wanted everybody masking, and so you still are going to have people who sit, at desks greeting patients, et cetera, who aren't typically trained. And so I think a lot of places had to expand that training program almost on no notice, to really get people used to wearing these things correctly. And if you think about it, if you work in healthcare, we set the example for what everyone sees. And so you want the person at that front desk to be wearing the mask correctly, not having their nose hanging out, not wearing it on their forehead and all the things that we see, not cutting a hole in the middle so you can breathe better and it sort of eliminates the function of the mask.
Yeah, I saw that more with some of the patients, really. So when we were asking our patients to universally mask, and many of them were not wearing those masks appropriately, it was sort of like incumbent on me as a healthcare physician to educate a patient on how to wear a mask appropriately. And then it was sort of an awkward conversation.
Mm-hmm. Yeah.
And I even had patients who maybe didn't think that COVID was as much of a risk as it was. And so that was also a challenge as well.
Mm-hmm. And I mean, the whole rhetoric around COVID has been very, very difficult in our society as a whole. So I can imagine that created more challenges, especially in trying to get everyone on board throughout an entire healthcare system in every single position, like you were discussing, Dr. Kuhar. What are your visions for the future on how we should best prepare to be ready for what might come up, both from a PPE perspective, but also specifically keeping equity in mind and trying to encompass everyone in our healthcare systems?
So I would certainly love to see a greater focus on having a wider variety of PPE in different sizes and shapes to fit all of our healthcare workers so that they can feel both valued and protected. I'd certainly also like to see there be perhaps a better effort at some of the things that Dr. Kuhar mentioned in terms of ensuring supply chains and making sure that the equipment that we need is available when we need it.
And Dr.
Easier
Kuhar,
said than done.
I would love your perspective on this too, from perhaps what you are already anticipating from the CDC standpoint, or what you would like to see you do.
Well, no, that, like I said, some of this is a lot big. A lot of these issues are bigger than CDC, and to some degree, manufacturers do what is going to be profitable for them. Mm-hmm. However, I think I couldn't echo what Dr. Jedlinski said enough, the importance of having a good variety for appropriate fit. And there's nothing better to have happen than a crisis that brings this to light. It gets people interested, it draws investment. And I think there's been a great realization that if we don't protect healthcare workers and they don't feel protected, that healthcare starts to collapse. And that is a complete disaster for the entire country and something that no one wants to see happen. So I'm hopeful that manufacturers are going to kind of expand those designs, et cetera. I know that the federal government has been working on sort of a more multi-agency kind of united front on ensuring that those supplies are available. And I think the other key thing is that I think it's important for healthcare workers to know, what do you do if your equipment's not fitting, and to remember you have options. OSHA requires that your employer provide you appropriate functioning equipment. Mm-hmm. You can talk to your employer about this and say, help me. This isn't fitting. I'm not sure what to do. It can go to a consultation with an occupational health provider to help you. And if you feel like your employer is not responding, OSHA on their website has an area that you can file a complaint. And they are responsive and will investigate to kind of make sure that someone addresses your safety needs. And so I think it's really important that people remember that there are options. It's not perfect. It's not always a one size fit all, but there are options in place to address this.
No pun intended with one size fit all. What were you going to say, Dr. Jedlinski?
No, that was a great point. Yeah, just knowing that there are options out there.
Mm-hmm. Well, that's a very uplifting note to kind of think about for the future. Thank you both so much for being here today. Are there any last final thoughts you would want to share with our audience? Dr. Jedlinski, I'll let you go first.
Yeah, I just again, I want always to have that lens of the equity and inclusion when it comes to anything involving provision of healthcare, and that includes taking care of our healthcare providers and clinicians.
Thank you, Dr. Kuhar.
Yeah, and I'd add, while it is an employer's responsibility to provide that equipment and to ensure that there's appropriate equity, et cetera, advocate for yourself and don't be afraid to do so. That equipment needs to fit correctly. You should be trained to remove it without contaminating yourself. And if it's not happening and you need to, ask questions, ask for help, and ask for training. It's one of the most important things for helping to make things better.
Well, those are great points to leave off. So everybody keep in mind, equity for all of your employees. And if it's not happening, advocate for yourself or for the people around you. Well, thank you so much for being with us. This has been such an enlightening conversation. And I look forward to hopefully having so much of the feedback that you guys have given be adapted in the future. Stories of Care is a publication of the AMA and CDC's Project First Line. Project First Line is a national infection control training collaborative working to provide all healthcare professionals with the foundational infection control knowledge they need and deserve to protect themselves, their patients, their coworkers, and their communities. For more information, trainings, and other infection control resources, visit cdc.gov/projectfirstline and amafirstline.org.